Greetings and welcome to the Cancer Interviews podcast. Thanks for joining us. I'm your host, Bruce Morton. Just as no two people are the same, no two cancer journeys are the same. Our guest on this episode is Max Schluter of Northfield Falls, Vermont. He's a survivor of prostate cancer, but while his journey has been an arduous journey dating back to 2011, he continues to fight and flourish. And we're about to hear his story now. So here he is, Max Schluter. And Max, welcome to Cancer Interviews.
Thank you, Bruce. Glad to be here.
We always like to start out the same way, and that is to learn a little bit about you, exclusive of your cancer journey. So, Max, if you would tell us a bit about where you're from, what you do for a living, what you have done for a living, and when time allows, what you do for fun.
Okay. Well, sure. I grew up in the 1950s in the Boston area, went to Boston College. Did a couple of years in the Army during Vietnam, like most people my age. And when I got out of the service, I went back to school and got my PhD in criminology. This was in Illinois, where I met my wife, Kay, of some 45 years, I'm pleased to say. I went on to a teaching career at George Mason University in Virginia, teaching criminal justice courses. Then we moved to Vermont and taught at Norwich University. Retired from that, then became the director of the Vermont Crime Information Center for about 16 years. Retired from that, became the director of the Crime Research Group, which was a research and policy outfit for criminal justice issues in Vermont. And then I've stayed retired. During all this time, I've really been a very avid, self-propelled sports enthusiast. I ski, I hike, I rock climb, I kayak, you name it, bike. We do it. Vermont's a great state for being in the outdoors.
Now, in order to do all that stuff, I would think you would have to be in pretty good health. So would you say that prior to your diagnosis, you were in good health?
I was. And in fact, all during the last, I would say 10 years of my cancer, I continue to do all of those things. Just recently, we had some issues, which we can talk about in time. But for the most part, the cancer, neither the cancer nor treatment affected my lifestyle.
At some point, you had to learn that something was a bit off kilter, something wasn't quite right. When did you notice something going wrong that led to the chain of events that led to your diagnosis?
Well, actually, I didn't notice anything. I was very fortunate. We have cancer, prostate cancer in the family. My father and my two older brothers had prostate cancer. So my primary care doctor and neurologist were watching me pretty closely. We were doing semi-annual PSAs, and mine had been very low, and then all of a sudden it popped up to 2, which normally people would ignore, but my primary care doctor was concerned about it. We did another one a month later, and that had gone to 4. So we decided to do a biopsy, which again would normally be unusual. But fortunately, we did it, and we found all of the samples had prostate cancer in them, and they were all what they call a high-grade cancer. They scored a 9 on the Gleason score, which is a score of aggressiveness of cancer. 9 out of 10 is about as aggressive as you can get.
It's always a very difficult bit of information to swallow when you're told that you have cancer, but were you somewhat prepared for this announcement after knowing what you knew about your family's history?
I was. For me, it was just a matter of time. I was hoping, because I lived a very healthy lifestyle, more so certainly than my brothers and my dad, and I still was surprised when we got the diagnosis, but it wasn't like some folks that, it comes out of the blue and really disrupts their life.
With prostate cancer, many times there are numerous options that the patient has in terms of how to go forward, and once they decide to do something about it, what they decide to do. Initially, did you go for a more proactive approach, or did you opt for active surveillance?
Well, because of the aggressiveness of the cancer, I went on Lupron right away, which is it's considered hormone therapy. It suppresses testosterone. And we debated a little bit and duked it out with the insurance company a little bit, but my urologist really wanted to do a bone scan to see if that cancer had metastasized. And we did, and it had indeed metastasized already to my hips and spine. So there wasn't a lot of option, at that point. I did consult some radiologists who were of the opinion that the cancer had gone too far already. It couldn't really be radiated. There was too much of it.
So what turned out to be the best option for you?
Well, about all I could do, remember this is back in 2011, was to continue with Lupron. And then my urologist discovered that down at Dana-Farber in Boston, they were offering a clinical trial where they were providing chemotherapy using Docetaxel with the Lupron. And again, this was not FDA approved. So I was very fortunate to get into that. And now that is the standard of care. If you have stage 4 prostate cancer, you'll be on Lupron and chemotherapy at the same time. So I was pleased to be able to help out in that effort by being in a clinical trial. And frankly, that treatment saved my life. That cancer was so virulent that I would have been dead probably in 18 months, is what they were estimating, had it not been for this treatment.
And I want to hear more about that treatment. But first, we just want to mention to you as you listen or watch, if you like what you hear on this segment, we invite you to subscribe to our podcast by clicking the links below. Once you're there, you'll see a bell icon. If you click on that, we will notify you when we post a new interview. Now, Max, if you would, let's continue with what you were going through with Dana-Farber. What was the next step?
So we went through that treatment, which was 6 infusions, approximately every 3 to 4 weeks. And then when that was done, we did a series of scans, and we all agreed that the cancer had really been stopped and had been put into an inactive period. And that really went pretty well, from looking at my notes here, for about 6 years. Then I felt that maybe I could take a vacation from Lupron, which is it's an approach that some people take in order to extend the life of the Lupron. I was having a very difficult time with hot flashes, which is one of the primary side effects of this drug. And I was having a hot flash at least every hour, every night, every day, every hour of the day, including nighttime. And so it would have been great to end that. So I did. I took a little bit of a break, and that was an unfortunate mistake, because as soon as we took the pressure off the cancer, it came back with a vengeance. And so in 2016, I went through another round of Docetaxel. And again, that was relatively successful. That slowed at least the cancer down. Continue, of course, to take the Lupron, and I was also taking a drug called Zytiga, which locks onto the cancer cells and prevents any absorption of testosterone that's produced anywhere in the body. At that point, I had developed some what they call rogue tumors, which are large tumors, larger than the rest of the tumors in my body. These were in my back. They were very painful. I couldn't lie down on my back. I was very limited in my motion. So we decided to radiate those. It's called spot radiation, and there was about 6 or 8 of them in my spine, and it was just 7 days, and that was really a wonderful thing. That took those tumors out and relieved all of the pain. So I was doing very well until 2019. So I got 2 years there. 2019, we're back. Cancer is spread now. Skull, ribs, continued in the spine. And we went with a similar drug. This one is called Cabazitaxel, to Docetaxel. And then COVID hit. And I was going to Boston for this treatment, and we were just about at the end, and I decided, and I didn't really want to go to Boston in the middle of the COVID pandemic. And so we cut that a little bit early. We got about a year out of that, and then everything went south. And by that I mean that we discovered that the cancer was producing a chemical called FGF23, which is natural in your body. And when you do a blood test for it, it's like the number is 123. My number was 7,000. And the FGF triggered an autoimmune reaction. And my immune system started to delaminate, which means to remove the linings of my nerves in my legs and feet, which basically left me paraplegic in a chair. I was admitted to Brigham and Women's Hospital, which is affiliated with Dana-Farber, and the doctors there got together and came up with a plan. This time we were using sort of an old-time drug, an old-time cancer drug for prostate called Cytoxin. And the hope was that that would hold the cancer in check while also neutralizing my immune system. And very fortunately for me, that did work. And the damage to my nervous system stopped. My cancer was at bay. However, you can only take that drug for about a year, which is what we did. We stopped in 2020. We waited to see what would happen, and we started some rumblings again with the immune system. So we went to a drug called Rituxan, which suppresses your immune system, which was a little scary to me because we were still in the pandemic. My cancer again started to rumble again, and we went to Xtandi, which again is a drug that prevents any kind of absorption of testosterone by your cancer, and that has held the cancer in place. I have a set of scans coming up next week, so we hope those are negative again. And again, the damage to my nervous system is still under control. And through a lot of PT, some great support, some great effort, I'm now up and walking, have some great braces. I can walk 2 miles a day. The other day I biked for 5 miles. I can get in, do my kayaking. And so my quality of life, despite all of that, is really excellent.
What I want to do now, Max, is backpedal a little bit and get away from the medical piece of this and get to maybe the mental and emotional piece. First of all, here you had been leading this very healthy lifestyle, and now cancer comes knocking, and now you've got to deal with all these drugs, and there's probably a feeling of a lack of control once those drugs are in your system because of what they do, their effects. How difficult was that emotionally, knowing that here you were, you'd been leading a healthy lifestyle, and there was this lack of control of your overall physical situation because of all the drugs you were taking, and you weren't even sure that they would do what they're supposed to do?
Yeah. Well, I was fortunate in the sense that I had a built-in support network from my two older brothers who were being treated at Dana-Farber by the same oncologist as I was at the same time. They were just a year or two further down the line, and so they were able to provide me with a lot of great support. But even with the best of support, once you're diagnosed with cancer and it's gone to stage 4, you have a terminal disease, and you know that you're going to die from prostate cancer, and the question really is just pushing it out as best you can with as good a quality of life as you can have. And somebody very, very wisely told me that this is like grief. This is like losing a spouse or a family member, because in a sense you have lost your life. You've lost the plans for your future. You've lost maybe your livelihood if you can't work. You've lost many aspects, as you say, of control over your life. And they went on to say that there's 3 questions to ask. One is, what did you lose? What do you have left? And what can you do with what you've got left? And I took that to heart. And instead of being depressed or distraught about this news, I was able to basically get on top of it, ask those 3 questions, and basically move forward. And that to me was, I think, the biggest help psychologically.
You had mentioned that the military had been in your background. I can tell you from other guests we've had that have also served, they have said that there are things that they learned in their military experience that help them deal with their cancer experience. Could that be said for you?
It could. One thing we always learned in the Army was to fight the fight that's in front of you. And what that meant to me was, I'm going to deal with what I need to deal with today. I'm not going to worry about what's going to happen 18 months from now. I'm not going to worry what's going to happen in reference to the next chemo or how effective it's going to be. I'm going to do what needs to be done today in terms of my medication, in terms of my PT, in terms of my exercise, whatever the case might be. And again, that's real helpful, because you can easily dig yourself into a very deep hole by worrying about what if this happens or that happens. So it helped me stay focused.
You had mentioned your brothers being a source of support. Anybody else, family, friends, that rallied to your side and made the journey a little bit easier?
Well, my wife, Kay, was a wonderful source of support for me. She was, the two of us were very close before, but we're even closer after the diagnosis, and we were looking at my lifespan being shortened considerably. The other thing that I wish I had done, but didn't until later, was get involved in a support group. I've only recently done that, and had I done it, I think I would have, it would have been helpful to me, not only in terms of emotional support, but also in terms of these little tips that people have about dealing with chemo or radiation, or especially if you're in a national group. And that one of the great things about Zoom is that you can be talking to people in California or Florida or whatever, and what you find out is treatment standards are a little different in different parts of the country, and so that you can really broaden your knowledge by being a part of a support group.
Now, I realized you didn't have a whole lot of choice when it came to going on the chemotherapy regimen that you went on, but you went on it, and there are certain aspects of chemo that are unpleasant. Your appetite, how food tastes, that sort of thing. But in retrospect, even though you didn't have a choice, you did take part in it. Are you glad that you underwent chemotherapy given the outcome?
Absolutely. The piece of advice that I would give people who are thinking about alternatives is chemotherapy is not as bad as people think. I've talked to a lot of cancer patients who did chemo, and we're all sort of of one mind. It is not as difficult as other forms of cancer and other forms of chemo. But for prostate cancer, the drugs are pretty, I don't want to say that there's no side effects, but they were really pretty minimal. I mean, when I was working, I didn't miss a day's work. There were some days when I closed my door and took a little nap for 10 or 15 minutes, but I still exercised every day, still worked. Fatigue, of course, is an issue with chemo, and there was only a couple of days on each cycle that I was really tired, but I still got out of bed. So for all intents and purposes, the chemo was a small price to pay for the benefit that I got from it.
Our guest is Max Schluter of Northfield Falls, Vermont. He's telling us about his prostate cancer journey, one that was so severe in its nature that you were, for a time, as you said, rendered paraplegic. And if you would, Max, talk a little bit more about the transition that you went through that got you from the point of being a paraplegic to where you are today, what you had to do, the involvement with the PTs, etc.
You know, in some senses, that was the worst part of the whole journey, was the neurological damage. Because as I said before that, I lived a very normal lifestyle for all intents and purposes. My lifestyle hadn't changed much. So when this came along, and given my active style of life, this was a real blow. And that's where this notion of what did you lose, what have you got, what can you continue to do was really helpful to me. The other thing that was very helpful is that I am a Buddhist, and I meditate every day, and the Buddhist philosophy embraces the sense of impermanence, that things change, and embrace the notion of being mindful of your thoughts. And so what I was able to do is use those techniques to harness the thoughts in my mind, avoiding negative, defeatist thoughts, and trying to move to a point of always working hard every day to improve. So at first, I was in a rehab hospital, and then I received PT at home, and then I was able to do PT in the hospital outpatient basis. And I had a fabulous outpatient physical therapist who was very concerned for me. I had worked with her for many years before that, and it just was slow and steady. But I kidded her by saying, well, I know I'm your favorite patient because I do what you tell me. And indeed I did. Every day I did the exercises, and gradually the nerve damage repaired, much to the surprise actually of my neurologists. And I send them little clips of me doing things, like a little clip skiing, or a little clip on my bike, or a little clip bowling. I tried bowling this winter for the first time, and they get a kick out of it. They need a lift. You know, so often they're dealing with cases that don't end well, and so I think they like to see successes from time to time.
Max, we are talking about prostate cancer, and two of the things that guys think about the most if they are diagnosed is urinary function and sexual function. For you, how have those been?
Well, of course, I didn't have a prostatectomy, removal of my prostate, which oftentimes is the cause. But the Lupron, because it eliminates testosterone from your body, also effectively eliminates any kind of libido. And my wife has been extraordinarily understanding. We talk about shifting from hot sex to cool sex in the sense of more showing affection and so forth. No real difficulties with urinary problems, as I said, because my prostate is intact. So that was never an issue.
You have talked about skiing and kayaking and rock climbing, that sort of thing, and you're still doing this. Are you back to 100% as far as that goes? Or have you had to kind of dial back your skill set as far as those things go in order to enjoy those sports?
Definitely had to dial it back, and that was a hard part of it. Before the neuropathy, our idea of a weekend was to go climb a 4,000-foot mountain in Vermont or New Hampshire. That's out of the question. Now, I don't have the stamina to do it. Part of that is due to the Xtandi, the current drug that I'm taking, which does cause some level of fatigue. Some of it is lack of stamina as a result of the body continuing to regenerate itself and to try to regenerate nerves. It takes a lot of energy for the body to do that. But with that said, a 2-mile hike in the woods, relatively flat, is still a great experience. And so it's just a matter of changing your perspective. We're still doing it, except we're doing it a little bit more slowly, a little bit shorter distances, and so forth. But it's been a hard adjustment, I have to say. But again, my wife has been great. She's been more than willing to do this. We have a joke about speed of walking, and Kay, who's walks pretty briskly, I'm walking more slowly, and we now call my speed of walking ceremonial. So I walk at a ceremonial speed. It's not quite that bad. But anyway, she's adjusted to that as well. And it's amazing that now we don't so much look at finishing the goal as you would when you're high altitude hiking to get to the top. That's the big goal now. We look at the ground a lot more, and look at the trees and look at the flowers, look at the stones and so forth, because we're walking at a ceremonial pace, and we can do that.
Ceremonial. It sounds like you should be waving to an adoring public.
I am. I'm waving to the squirrels and the trout lilies and so forth. But yeah, that's a little overstatement, I realize. I'm not quite that bad.
But it sounds like the way you're hiking is a more fulfilling experience, both physically, mentally, spiritually, everything else. With you, you're still getting in that exercise, but you're taking in all the beauty that is around you in Vermont, and there's certainly plenty of that. So overall, it sounds like a great experience when you and your wife get outside.
Yeah. Yeah, one of the other things that I've learned from my Buddhist practice is to develop a gratitude practice, which means basically to look for things to be grateful for. And the more you do that, the more you'll find things. And even in some of the darkest days, I could be grateful to the infusion nurses at the hospital who were so kind, or the dedication of my doctors, or the kindness of my friends who were driving me to chemo appointments and whatever. And that certainly lifted my spirits. It continues to keep those spirits up, because we certainly have a lot to be grateful for living here in the United States and having access to great medical care, many of us having really good insurance to cover a lot of the costs of these sorts of things.
Max, we want to wrap up now, and we always finish from pretty much the same place, and that is that I would like for you to picture yourself having a private audience with somebody who has not only been diagnosed with prostate cancer, but has been diagnosed with the acute sort of prostate cancer with which you were diagnosed. If you had a chance to speak to that person, I suspect there are many things you would say to them, but if there's one overarching message, what would it be?
I would say that now that you have this diagnosis, your life has changed. And now, the most important thing for you to do every day is to do everything you can to beat this cancer. So if that means exercising, if that means taking drugs, if that means driving long distance for treatment, that's what you need to do. Other things now fall by the wayside. Your work, your other sorts of hobbies and so forth, they've got to come second. And for a lot of people, that's a difficult transition to make, but it is a winning recipe, believe me.
Wonderful. Max, thanks so much. Thanks so much for sharing your story. You have come back from quite a deficit, if we were to make sort of a sports analogy, to position yourself where you are now. And best wishes to you and Kay as you go forward. Max, thanks so much for taking the time with us on Cancer Interviews.
Thanks, Bruce. I hope somebody watches this and is helped by it.
It's hard to imagine that it wouldn't. And that's going to wrap it up for this episode of Cancer Interviews. We want to remind you once again that if you are on a cancer journey or you know somebody who is, you are not alone. There are people like Max out there who have information and inspiration for you that can help you along your way with your cancer journey. So until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews podcast.